They're all gone. Very good. One question.
Hello guys, I can see that that it's 7 of us as of now. I'm sure. I guess some other people might join, but so it's 7 right now. My name is Stavros. Can you hear me? Yeah. Okay. My name is Stavros. I'm a pediatric cardiology consultant. Is anyone keen to help with note taking?
Silvia, agenda. Is that the one you are talking? Yeah, if you click open, you should have the same one, and then you click the bottom second tab, CNE groups info.
Somebody is not muted there. Yeah. Anyone keen to help with note taking by any chance? Any takers? No one is keen to do that. That's fine. I'll keep some notes. I'll try to do both things at once. So who would like to talk for a bit? We only have 14 minutes. So anyone who would like to introduce themselves and talk a little bit, it would be nice. If anyone has any cameras which they could turn on, it could also be nice since we are on speed dating. If anyone wants to say anything, please feel free to raise your hand virtually. So who would like to go first?
Hi Stavros, my name is Indu and
Hi,
I'm
Indu.
a lecturer in ECS. I work on assistive technologies and robots for health and care applications. One of the in recent interests that I was looking into is the use of heart rate discrimination tasks and heart rate so the interoception sensibility using heart rate. So I was just wondering if I can discuss more about that. Is there some so I was just wondering how prevalent is the technique in the field.
So in simple terms, what is that you are looking into?
The topic is actually interoception, and then I have been looking at papers that use cardiac feedback, heart rate feedback as a training for interoception sensitivity. So I was just wondering if there is any discussion that can happen on this.
Mm-hmm. Anyone to comment on that? Fine. I haven't been involved in the field, to be honest, of interoception sensitivity. But feel free to send me an email. I can put my email address over there, and we can take a look into that if you want. Anyone else keen to introduce themselves?
Hello, my name is Mercedes. I'm a lecturer at computer science. I also gave a short presentation a while ago. I joined this room because I'm about to work in a very small project or pilot about neurosurgery and cardiac patients, and in particular, the kind of treatment they are is under consideration for the score. So I just wonder if there is any interest in, I don't know, follow up what we do. So hopefully in some point there will be some common interest or something that maybe some people can contribute if there is some interest. This is led by a neuro surgery unit at Royal Salford Hospital, which is supposed to be one of the biggest or the largest neurosurgery unit in the UK. And as I say, one of the things that they are considering is the treatment of cardiac patients. I don't have much information at the moment because this is just starting, but I'm just wondering if there is some interest. I will be more than happy to provide like a short intro or brief, you know, what is the goal of this project, and perhaps, you know, some people will be interested. I mean, maybe even just knowing what this is about. Maybe some of you may have some ideas or wanted to contribute or wanted to do something similar. We aim to use patient records information that is used at the trust, and also biomedical information that comes from the literature. So in order to develop this scoring, is going to be a mixture of information coming from the literature and also from patient records. And mostly what we're trying to do is back up whatever intuition these doctors have in order to do this scoring. The scoring is supposed to aid the decision in terms of doing surgery or not for certain type of patients.
Okay, so in essence, are you using machine learning in order to develop a kind of predictive scoring? Is that right?
Yes, I mean, we are going to use multiple methods, and of course, the clinicians are interested not only in whatever machine learning algorithms may say, but also this kind of explainable or retracing or justifying why this feature might be important. From my point of view,
developing scoring and also getting a reasoning behind that.
Yes, exactly. So that's why it is explainable AI, in the sense that this is for clinicians and clinicians are involved in this, but maybe this is an opportunity in order to, you know, other people may be thinking of similar things, and we are quite happy to share our experience if there is interest in this. As I say, it's very new, so we have, you know, we have just started, so I can provide a short outline, and you know, I will be happy to, yes, to have anybody on board who is interested in this.
But Mercedes, I've put my email over there. Is anybody else? I mean, you can email me about an outline just to get to meet each other. But and we can look into that further if you want. Anybody else who wants to comment or introduce themselves?
Thank you so much.
Thanks, Mercedes.
And follow this absence.
So we have. Who else do we have on? We have Matthew Kumson. Matthew or Matt, would you like to introduce yourself?
Yeah, I'm a consultant at the Royal Surrey County Hospital. I was just, I'm interested. I think cardiology wasn't presented in the talks. I wanted to know if there were anything special, going on here.
Okay. Are you a consultant cardiologist?
No. Obstetrician gynecologist.
Obstetrician, yeah, good.
I see pregnant women with heart problems. So
which hospital is it again?
Royal Surrey County Hospital in Guildford. Yes.
Yeah.
So
okay.
And I see pregnant women with medical issues, all sorts of, including cardiac and all that. So I just
I think I think the changes, the physiology changes, and the cardiovascular changes of women with cardiac issues and congenital heart disease during pregnancy are interesting, and it's a whole area which is very interesting, and people can give it a think of whether anybody would like to get involved into that, yeah, so that's something to think about. And we also have Christine Evers. Is that right? Is Christine on? Nope. And we also have Zhao Hao. I don't know if Zhao Hao is on. They seem to be on hold, it says. And
yeah, I guess they were jumping in between the groups, so maybe
jumping between groups. Okay. Fine. So Indu and Mercedes, I would be more than glad to get an email from you just to meet each other and online via email, and then see if there is anything that we can plan either
Sure.
now or in the future.
Actually, I have a comment on Matthew's work. The one of the things that I'm looking into is the well-being and mental well-being and pain management. So whatever interventions or technologies that can help for that, and it seems like cardiac problems in pregnant women could be an interesting area, in the sense that if they have probably like a grip on some heart rate awareness, or the breathing patterns or something like that, do you think these kind of interventions can actually help manage the cardiac health and gastric health of pregnant women?
Could you explain a bit further? You mean heart rate and all? Because I mean heart rate does go up in pregnancy.
Yeah.
Yes. I mean by about 10 to 15 beats per minute higher above baseline, and there are a whole host of cardiovascular changes. I only wish that whatever innovations you are thinking, you factor in pregnant women because they are a special subset of population, isn't it? Because often studies will be done without consideration for pregnant women. So in hindsight, the people realize that, oh, they should have included them. I mean, when it comes to pharmaceuticals, you take BNF and a lot of drugs, the caution is not for pregnant women, because of course they weren't considered in the first place. So I think that if any innovation, you do consider any innovations, just to think of pregnant women as well, so that you factor them in.
Yeah, definitely. So I'm just looking into if we can develop any interventions or the well-being technologies that can help them monitor their heart rate. So I was just wondering if there are any critical events that they should be aware of during the pregnancy. For example, if they are having some gastric or heart troubles, will having some feedback help them be more aware of the situation?
I mean, when it comes to cardiac too, I mean, there are a whole host of different cardiac problems, and the commonest being hypertension, and we're doing home BP monitoring now. They check their blood pressure. Yeah, you check. That's the using the Hampton app. They check their blood pressure, and then the midwives review the blood pressure on an app, and then invite the ladies in if they think there are any issues. The heart rate per se often is not factored in, but that bit is important, particularly when they start medication. But often as a baseline, sometimes it's not sort of recorded. But you are right in the terms that when we measure blood pressure, we also have to measure the heart rate. You understand? It all.
One thing. I mean, you could I mean, I don't know if this could be looked into actually, but actually, you know, it's I'm a pediatric and fetal cardiologist actually, and since you brought this up, you know, you could possibly think about looking into the symptoms of preeclampsia, because it does have hypertension, but also there are symptoms that actually, you know, and preeclampsia is not always picked up on time. In a timely manner. And another thing that you mentioned, since you mentioned also about heart rate and interoception, and actually is we could look into maybe the perception of palpitations, which when in case you have any abnormal heart rhythm, any tachycardias, and see if actually how patients are perceiving palpitations, and what if actually this correlates with you know, with actually, is there any difference in the way that patients are perceiving palpitations when it has a normal rhythm or when it has an abnormal rhythm, for example, because we can detect if it's normal or abnormal, the rhythm with an ambulatory ECG with a Holter. But what is the difference in perception, for example? You know, it's like, is it something? Is it a different way that they are perceiving palpitations when they have an abnormal rhythm? Is it a different way that they are perceiving it when they have a normal rhythm?
Mothers will always, I mean, report.
And I don't mean only about the, you know, pregnancy, but
mothers will always report, I mean, palpitations. I mean, when it's new, or if it's new, they will always, I mean, sort of report it. And as you've rightly put it, I mean, we tend to request the 24-hour monitoring for them. Sometimes the Holter, that is with the BP measurement inclusive. So, and then we do some baseline and biochemistry as well, thyroid function tests, check their calcium, magnesium, and levels and all that. So, I mean, whenever women perceive palpitations and it's an issue for them, they will report it. And we know it's a common presentation in pregnancy anyway, mostly benign. But of course, if they volunteer it, and particularly if there are associated symptoms of shortness of breath, dizziness, and all that, then it even becomes more of a concern. And we get sometimes we organize an echocardiogram as well, yes, as part of the investigation.
I was wondering if the data of any of these cases are available. Is there a data set that is reliable for this kind of cases?
I mean, in terms of women with palpitations, or what?
Yeah.
You will find in the NHS that you will, you know, people would need to go through the notes.
Yeah, you have to go through the notes, and for about nearly 2.5 years now, we've been using the digital set of notes. I mean, to get a note, one will have to look at patients. In fact, you have to look at palpitations in general, because you find people who from the outset didn't have any heart problem, but then subsequently develop palpitations, you understand? So palpitations as a symptom will draw out more women, and then you can look at how they were investigated and then the eventual outcome. I mean, as I said, majority are benign, but saying that I know one woman who's actually it was because of cardiomyopathy, yes, and was transferred across to have delivery in London in a tertiary unit. It was
Matthew, can you put your email address over there in the meeting, because we need to move, we need to conclude because of time. But we can keep in touch with each other.
Yeah, thank you very much. I think I've got some interesting insights.
Thank you very much, guys. Thank you very much.
Thank you.
Take care. Cheers. Bye bye. You can go back to the main meeting if you want.